I'm so happy to have you on the show. This has been really, I kind of forced my way in. I was like, hey, yes, I will come up to the Farmers First, this big farmers market that is here in DC this week. But hey, while I'm there, can we do some shows?
That's right. It was perfect.
You guys are so generous here at America First Policy. And I'm just excited to be here because there's so much happening and it's so relevant right now. Right. So really just being able to be here on location, and it's just different energetically when you're in it and everything's going on, and just what Secretary Rollins and the team and Tate and that team here at AFPI has pulled off this week for this great American farmers market is just unbelievable. I know it's been a lot of work, and it's so exciting just to see how we're showcasing our American farmers. But I really want to talk about America First Women's. So let's start with that, because this is a new I don't know if to call it a branch. I don't know what it is. What do you call it? But part of America First Policy Institute, and it is something that's so important. But I just want to know, how did this get born?
Right, exactly. Well, Terry, thank you for having me. We think you're incredible here at AFPI, and what you've done. You and Dan have worked so hard to actually be a voice for America. No matter what side of the aisle we're on, it's not about red and blue. It's about red, white, and blue.
That's right.
And you and your husband have always stood for that. And no matter, you do what's right. And that's what we love about you. So thank you so much for asking to be in the studios. Our studio is your studio.
Yeah. Well, people need to know about what we're doing up here.
What we're doing. Why is DC so important? Why are so many things happening right now? You mentioned Farmers First, America First Farmers here, and Tate and Brooke Rollins, Secretary Rollins. Brooke was the founding woman, instead of founding father, founding woman of AFPI, along with Secretary Linda McMahon and Larry Kudlow and Newt Gingrich. And it was an incredible team that came together for a time such as this 4 years ago, when we knew we were losing and there was no hope. They said, we cannot give up. We had such a plan for that second term, and it didn't matter what type of where you are on the issues. We talk about freedom.
Right.
It doesn't matter who's in the office, as long as they're talking about freedom and they're at the tip of the spear. Yeah. So thank you so much for always understanding that was. It's not a policy play.
No.
It's not a politics play.
Freedom
is a people
play.
It's absolutely. It's all about the people. Absolutely. And speaking of which, I want to show you something you have not seen yet.
Okay.
This is really
fun.
Exciting. So I'm unveiling it for the very first time, and I want you to read it and see what it is.
Oh.
It's an op-ed.
Can I read it out loud?
Yes. It got put in Town Hall here in DC.
Wow.
Just this week. You've been featured.
I'm gonna cry.
Been featured here in DC because you have been to HHS, Health and Human Services. You know what they're doing over there. The good and the bad and the ugly of what's happened in healthcare. You've seen it firsthand. You've experienced it. You're helping people through the process of it. But you and I are co-authors on an op-ed that ran here in DC, and the president and everyone is so excited about the work that you're doing.
Thank you
so it was an
much.
honor to be
I want to read this out loud. We're using SNAP dollars to buy junk food, and it's fueling America's chronic disease crisis. And yes, you are so right. Preventing chronic disease is my life's work. I'm passionate about it. As you know, there's a cornerstone of hormones, but the food impacts hormones. Yes, I have a whole chapter about it in my book.
It's my book. You can't have it. Nobody else can have it. I've yellow highlighted the heck out of it. But you've got to get Terry's book. This is an amazing about hormones. But there's one spot in here that I would love for you to share with the viewers about how you quote your experience in this issue.
It's a big issue.
It's a big issue. Sure. And I wanted to, I'm going to find, I should have marked it before I got on.
Right.
I'm so sorry. But it's so noteworthy about how the preventative, you always talk about the preventative. And this right here, sweetheart, if you could just read that. And for my viewers too, I'm going to.
For 1 second.
Yes.
Stacy, would you mind tucking on your back right side? Your jacket is coming up over the chair.
And we'll edit all that out.
Perfect.
Oh, okay, great.
This part.
Okay, great.
So,
good.
Yeah.
Perfect.
All right, good to go.
Okay, so Stacy wants me to read part of this op-ed, so this is great. As a board-certified nurse practitioner specializing in preventive, functional, and hormone health, I've seen firsthand the devastating consequences of nutrition-related diseases. Too often, daily,
yes,
I meet patients after they've already suffered when our system should have helped them prevent illness in the first place. Healthy nutrition should be encouraged at the state level, and these waivers are a great way to support public health. President Trump's Make America Healthy Again initiative is charting a new course for food policy. And I've said it on a couple of interviews that I've been so happy to do here in AFPI studio this today, actually, with Tate Bennett, and just talking about the ag industry and how food plays such an important role in chronic disease, and also some other guests that I've had on. So I really appreciate this. Is exciting.
Right in town hall.
Right in town hall. Okay. Do I get to keep that one
already? But yes, this is your copy. We made more than a few copies here at AFPI because we're all so proud of it.
I need links. So we need to get it out there to the world.
So all of you guys can read it. But it's quite monumental to come to a city like DC. As you can imagine, so many different op-eds get looked at every day, and what is chosen to be published. Right. So it was quite honorable to be able to be talking about something you've been living with you and your patients.
Well, and it's another reason why I'm so excited about America First Women's and the Truth Initiative and the healthcare pillar, which we're going to get to, because so much attention needs to be placed on this. And I'm just when I just with everything, the momentum that's happening right now in DC around health, and again, you've said it, I'm going to say it 100 times. It is a bipartisan issue.
That's right.
The health of our nation, the health of our children, healthcare should not be a partisan issue, and it should be affordable and accessible. And we're going to talk a little bit more about that.
Absolutely, and there's so much around that.
Oh yeah. So America First Women's. Why
America First Women's Initiative? So Linda McMahon, who's now Secretary McMahon at Education, Brooke Rollins, along with 8 other of our leadership team, have been deployed into the administration. When Brooke Rollins and Linda left, they're like, Stace, a lot of our leadership's going. We had 81 go into the administration from America First Policy Institute. We've brought in 65 new people, and people will rotate within this 4 years. They'll go into administration, they'll come out, they'll come back to our do tank. We don't call ourselves a think tank because we're actually doing it.
Do tank.
Getting things done. 86% of the policies and executive orders that have been put into the first 100 days of this administration came from our tank. We don't talk about that enough out there.
That's right.
But because we don't want to get over our skis, President Trump and his administration, and there's 28 people in the cabinet, 8 members are women. They make the decisions about what rolls out. We just help supplement them with information and write papers and policy. So that is our goal. So when the ladies went into the administration, they're like, Stace, we need you to be in leadership. We want you to be a chair forever. I was here 4 years in Dallas, 3 years on the road for AFPI, just telling the story, framing and messaging. But they said, we just really want you to be in DC. So I came here in March, moved to DC, have met so many amazing people that say, yes, we need a chair for a women's initiative that goes out and speaks to the grassroots across the country. So with our America First Works department, that division is great with Ashley Hyliak. She's amazing. She's working with 100 coalitions and grassroots organizations around the nation. Every Monday at 1:30, we have a call. We talk amongst ourselves. We say what we're doing, where we've been, where we're going. Each state tells us what their needs, wants, and desires are, whether it's, the primaries.
Unbelievable.
That's important.
Oh, yeah.
What are we going to do in 2026? What does the laws look like? It's all about law and order. It's about kingdom and country. Kingdom first, country second. We have to do it in that order. We have to think about how we want to treat our neighbors, how we want to talk to our neighbors, how do we get them to see common sense protocols. So with the Truth Initiative, that's 5 pillars that fall under the Women's Initiative, it's all about transparency in government, revitalization and reformation for women, the unity across political and cultural divides, trust in our nation's goodness and greatness, the history of America. Children have lost that. We're getting ready to do a 50-city tour with the Education Department. We'll travel the nation with Secretary McMahon, with AFPI as the leader of the team of events, working to get the message out there. What does history really look like for America? We've lost so much of that. And then the H in truth is health, which is what you have been incredible to know about. It's mind, body, spirit, and our land.
That's right.
Like Secretary
without the land, you have none of the rest.
You have nothing. You have nothing. When Governor Kristi Noem was a governor for South Dakota, AFPI worked with her on all the bills and stipulations to get passed that if you are an adversary from any other country that not American descent, you can't own land. We were finding hundreds of thousands of acres across America being purchased up near military bases. That was our
this day.
Farmers and rancher land that they were taking, but it was also a homeland security issue. They're all near military bases. When you look at the map, we'll send you the map for you to throw up. When you look at the map on the screen, you'll see all that CCP money went into those states. So Kristi Noem said no more, set a bill in motion, that was it. Took all the people that owned, that were adversaries and not allies of America, and took their land and said, we're going to sell it, we'll give you what we can for it, but we're going to retain that land back. Same thing with Sarah Huckabee Sanders. She did the same thing, Arkansas. She said, you know what, 186,000 acres are owned by people that are not Americans. Our ranch and farmland is being bought up because we made them so destitute. It's a national security issue. If people can't eat, they can't think about anything else.
That's right.
You'll lose them at hello. So they have to have nutritional food. So she passed that bill with our support and help. Her and Brooke Rollins worked on that really hard and got that bill passed in Arkansas, and they sold the land out.
And was it a big
retained
surprise for Secretary Rollins to see how much of this was going on?
We didn't know how much, even though we have a China initiative right here at AFPI, and we have experts that delve into that every day. Adam Savitt, he's amazing at it. Tate Bennett, who you've spoken to, they have the knowledge of it, but we didn't know how big and how abusive that this had been going on, where governors really didn't even know in their states who was buying up land. I mean, you can put an LLC, a company, under anybody, but when you follow the money, always follow the money, you find out where the nefarious actions happen.
Absolutely. And it's something that people need to be aware of, so I'm so glad you brought that up.
And it's all about transparency, right? So that's one of the first T in truth.
That's part of the T.
That's right. First T in truth is transparency in government. 87% of the voters, Terry, support price transparency in our health care system. And we need to control those costs.
Talk about that.
Let's talk about it, because I was on the phone this morning with a friend of yours, Governor Bobby Jindal, and he was talking to us, and he said, Stace, here's the deal. We're going to start passing this. Look, they always talk about Medicare. The cost of Medicare. Oh, we're going to cancel Medicare. Here's the thing about Medicare. If we had affordable health care, instead of sick care system, affordable health care system,
which starts
people
with
wouldn't need the Medicare.
That's our whole rant.
You would be, everyone in the country would have great health care.
I want to address something that, just to bring awareness, because this is a real problem, and everybody knows, has heard of or knows somebody on some of this class of medications called the GLP-1 medications.
That's right.
And this is a big deal right now, because what is happening is the pharmaceutical industry, specifically Eli Lilly and Novo Nordisk, they are really trying to grab the market share and eke out compounders in this area. And this is a really important conversation. They're trying to create, and they're working with other coalitions like the Obesity Society and things like that. And there's so much bias. But what they're doing, there's a couple of things that they're doing. Number one, we all get our API, the raw product, from the same places.
That's right.
And compounding pharmacies are highly regulated. And so this misinformation that it's somehow safer or not as safe, or only the expensive $2,000 medication is the only safe medication, that's just a bunch of BS. And this needs to be talked about with the transparency piece, because what's happening is when you're forcing people, when you are not giving people, doctors and patients, choice.
That's right.
This is all about freedom. Medical freedom. You're not giving them the choice to choose. I want a compounded version of this semaglutide or tirzepatide. My insurance doesn't cover, and insurance companies are not paying. Do you know what their proposed solution is?
What?
To force the insurance companies to pay for the branded medications for Medicare, Medicaid. That is ridiculous, because who pays for that? Taxpayers pay for that.
We all pay individually.
So now what you're doing, what they're trying to do is they're eking out the compounders, which is a that's a big industry when you talk about commerce. But more than that, doctors that want to maybe prescribe their patients a different dose than what's commercially available because their patients get too sick on a certain dose.
Right.
Or the fact that a compounded version of this medication is anywhere from $200 to $400 instead of $2,000.
Right.
So this is the kind of thing, I love that this has come up, because it is so vitally important, and we've got to quit letting the pharmaceutical industry have such a stronghold on our healthcare system. And pricing with medications is just one of them.
It's just one of the things.
So I'm so glad you brought that up. Sorry, I went on a rant about that.
I love that, because
I'm very passionate
as a
about
layman person out in the marketplace that knows nothing about health and the system, because we don't know.
So people that are
awareness.
and let me tell you, these medications have been life-changing game changers for so many people that could never lose weight or get their diabetes under control before that. And we get calls every day. I'm hearing that my compounded tirzepatide is going to go away. What do I do? But you know what else it does? It forces people into the black market for their medications.
Absolutely, and that's dangerous.
A problem.
And that's dangerous. As we were getting prepared for this, Lauren and I were looking up some statistics, and if I could just share it, in 2022, nearly 2 million individuals lost their lives to obesity in this country.
That is amazing.
Because of chronic disease.
Yeah. Preventable.
Exactly. That was the thing that we said, like, was this preventable?
Yep.
And we're like, yes,
100%.
because the life expectancy in the United States falls behind that of other developed nations. That was pre-COVID-19, okay? So the average of 78.8 years compared to 82.6 years in similar countries.
Yep.
We're passing away at 78. They've got they live to 82 on average, right?
Yep.
Because their healthcare system is totally
and their
a more wellness
system is different.
Yes,
that's why I love all the talk about food.
The food, well,
it's where it starts.
With the farmers, the agricultural, we talk about health for mind, body, and spirits. Right now, women represent 36.3% of U.S. agricultural producers in 2017, and approximately 1.2 million out of the 3.4 million farmers are females out there making sure food supply is safe and nutritious.
That's awesome.
There are people out in the industry, but we make so much red tape for my family's ranchers, 4 generations. So ranchers and farmers, all this USDA, Brooke Rollins has got in there and said no more.
Yeah.
All this red tape, trying for just follow the money.
Yeah, follow the money.
Follow the money. If
Always.
we could just do, like my dad owned slaughterhouses for years, if everything was always up to snuff, because you have to have
same thing with compounding pharmacies.
Same thing. You have to have clean facilities, right?
Absolutely.
And it's regulated.
They're so
that
regulated.
Stuff is so important.
That's so important.
It's so important. But you can go over the top and start fining for this. And that government overreach, again, transparency in government. I always say God over government. We've got to get some common sense about it.
Just to be clear, when you talk about kingdom, you're talking about God's kingdom.
Yeah, God's kingdom.
I want to just make sure, because you said kingdom and then country. I'm like, God's kingdom.
God's kingdom, because it is God over country and and over government. He gave us this country to preserve it.
Yeah, 100%.
And our founding fathers gave everything to keep it. And if we don't work as a republic to keep our nation, keep our farmers and our ranchers in good standing and so that they can actually make money.
Absolutely.
They don't have to sell the family farm.
Yeah.
I mean, gosh, all these droughts we saw a couple of years ago in Texas, I was living in Texas where you guys are from. I freak out. I'm like, look, we had so many cattlemen having to sell their land because they couldn't get water.
Irrigate.
When we have so much aquifers under Texas, I mean, we're sitting on gold mines.
That shouldn't even happen.
Should have never even happened. They were having to take their cattle to Oklahoma and Kansas with friends of ours that own slaughterhouses because they were so backed up because people were just having to get rid of livestock so they didn't lose the lives of their livestock.
Yeah.
And that became a problem because then, of course, they were selling, for a dime on the dollar, or their cattle losing money, having to freight them to Oklahoma and Kansas just to get a facility that would take their herd because all the Texas slaughterhouses were full.
Yeah,
it's been craziness for years.
It peels back to what you just said is the overreach.
It's overreach.
And the red tape of
right.
getting help. And I love what this administration is doing, is bringing awareness to what's been going on in the ag industry, in the farming community, the farming and
It's important. We have to oppose it strongly.
And the transparency piece of truth is the first step.
Yes.
And again, I just think I was able to be on, I've said this when I talked to Tate, I was able to be on a call with some influencers in the ag industry, and Secretary Rollins was on there, and just there's so many layers. And so many problems you just wouldn't even think of if it's not your world.
Yeah.
And again, it's so important, and I keep bringing this back home. Why, Terry, are you talking about this on your show? Well, let's see. I'm passionate about health care. I'm passionate about disease prevention, and it rolls back to the food.
Yes.
The food is what is causing the chronic disease, which is causing all of the other problems and burdens in our society.
And what you taught me years ago is you said, Stace, if you walk in a grocery store, do the circumference of the store.
Yeah.
That's where your healthy food is. Those middle aisles,
well,
if you look at it, it's kind of all the junk food.
100%. And if you've ever shopped, and I know you have because you lived in Paris for 10 years when you were a Ford model.
Yeah.
But if you ever shop in some of these European grocery stores, they don't even have a middle. I mean, it's like maybe 2 rows of some things.
Olive
everything
oils
else
and
is fresh.
Yeah, right. Everything else is fresh.
Yeah. So if we could just model that, of course, anyway, that's
everything in moderation.
We digress. But
there's everything in moderation. But if we can make food affordable in America that's healthy, will change everything.
Where's the around transparency? We're talking about transparency.
Right.
Why aren't we requiring transparency in our food labels and our marketing?
I know.
Moms are marketed to big time with packaged and processed foods, and so are kids.
Yes.
And what they don't understand is it's not true marketing.
No.
It's not. It's false advertising.
False advertising.
And these are very addictive foods, and they're really causing a lot of problems in our country.
It's true. But it's in everything. I mean, if you look at the FDA, under the FDA also falls cosmetics.
Yep.
And I was in the cosmetic industry for 30 years and fighting for labeling.
Yep.
Accurate labeling, healthy labeling. I mean, I could talk circles around people about parabens and everything that we put in all personal care, hair care, skin care.
Absolutely, and that's just toxins. And it's just like I was talking with Tate earlier about the EPA and how the EPA has such regulations on chemicals, but it's not. There's not that much oversight in our or at least that much thought or care given to the food and the cosmetic industry.
Right. Well, you look at the advertisers, it always follows the advertising dollars.
For sure.
I mean, if you think about all the big corporations, it's a corporate overreach as well. Because they dictate the marketing, because they own it.
Yeah, 100%.
I mean, just like years ago.
So how can we find a balance between all this? I mean, obviously, I love our capitalist
we
society,
do.
but I say this all the time, it's the back of the hand of capitalism.
That's right.
We've got to be able to find a balance to take care of our people. So transparency in government, anything else you want to say about that?
Well, because I'm best friends with Linda McMahon, I gotta mention education.
Yes.
84% of Americans believe that parents should be able to see all curriculum, all the plans, all the materials, all of that for education.
Yep.
And I think today, what came out of COVID was parents found out what their kids were actually learning. We didn't know before. We didn't know before what they were being taught. We trusted the education system, some of us, and most of us, I would say.
Many of us,
I would say 75% of Americans didn't know what their kids were being taught in school.
Right.
They thought it was back in the day when we were being taught.
Sure.
It's like totally not. I mean, what freaks me out is I was talking to a friend the other day, and she is a science teacher. Mm-hmm. They no longer do labs. Remember when we were kids and you had to do
That's the most fun part of school.
I know. Remember when you had to dissect the frog and do all the thing, and you learned so much about hands-on. Mm-hmm. They have none of that anymore.
Yeah.
Zero. Wow. No labs, no learning of anything. It's just like, I mean, I had home ec and wood shop class and all that. No hands
None
on
of that-
anything.
that
I mean,
we've
if
gotta-
it's not
we've
an
gotta
iPad,
turn that around.
yeah, we got to change that whole and have parents be accountable and run for office in your,
Yes,
local is national.
local, yep.
We've learned that, but just in the last couple of years, that those are the most powerful seats.
Yep.
Department of Education in your local
Your school board.
is like so powerful. So we've got to talk about that. Transparency for Women's Initiative is also about the human trafficking.
Yes.
It's coming. It's coming, but people don't realize that it's $150 billion annually.
Unbelievable.
Global profits. 150 with a B.
Do you know what I learned earlier today too that
What?
I just would have never, is that even humans are being smuggled in with produce across the borders.
Yeah. Absolutely.
Like,
You don't even know they're
think about that.
hidden. And within our borders, nearly 500,000 victims of human trafficking are located just in the United
Yeah.
States.
Unbelievable.
So that's nearly 71% of all reported incidents of human trafficking are happening
That's
here
what's
in America.
reported.
And they're attributed to the sex trafficking.
Yeah, wow.
So there's so much under transparency that falls under that T. The next one is reaffirmation and reaffirming of women's roles in America. 73% of women either oppose or strongly oppose using tax dollars in supporting for abortion clinics.
Yeah.
People don't talk about it because
Yeah.
it's one of those issues we're just not going to talk
Yeah,
about it, right?
yeah.
But people they need to know, like,
People need to be
Planned
honest about their opinion
Parenthood
about
was
it.
just
Yeah.
that
Yeah.
when the whistleblowers came out and said, "Oh, human body parts are being sold,"
Yep.
and people got, instead of thinking pro-life, how about just pro-love?
Yeah.
Not anymore. Are we going to just think about the child? We need to think about the woman and the child and what she
100%,
mentally goes
100%.
through and thinking through that process about taking the life of her
and,
own unborn.
100%, and that's why I love the hope agenda
here, yes.
I mean, because we can't just have these opinions
Right.
and not give alternatives
Alternatives.
for
We've gotta
moms
have an
that are
answer.
making these really tough decisions and have an answer.
You're right,
Yeah.
Terry. We're writing all foster care, all
Yeah.
new regulations for foster care to make it easier in America. So if a young woman does get pregnant and she's not able to afford to have her child, she doesn't have to go towards the abortion.
Right.
She can have her child and let it live out its life and be something grand for
Yeah.
her and the hope of another family that couldn't have a baby or
Listen,
maybe want more children.
That is a conversation that's near and dear to my heart because I was adopted. My mother was a senior in high school,
Yep.
18 years old, and she had witnessed her sister actually undergo a forced abortion.
Yes.
And so she hid her pregnancy from her family with me till she was far enough along to have me, and
Right.
then was able to give me up for adoption. And what a bold move on her part to keep it a secret in the 60s. I was born in 1967.
Right.
But, I feel so blessed that I'm
Yes.
here to do what I'm doing.
That's right.
The perfect example
And think of the
adoption.
world without you. We wouldn't
Yeah.
have Maya. We wouldn't
Yeah,
have your
exactly.
legacy and your
Yeah.
grandchildren and
All
your
the things.
daughters
So,
and
yeah,
sons.
I love
I
that.
mean, you just wouldn't. So thank God we're working on that with
Yep.
Margot here at
Love
AFPI.
that.
She's an incredible person about.
So the Hope Agenda is
Hope
still
Agenda
alive
is alive and well and doing
good.
so many things. She just
Yeah.
did on the Hill. She just had a moment with the Senate. We were able to go and watch her speak
Nice.
about the new programs. We're also working heavily here with Jessica Hart-Steinman, who's head of our legal
Yeah.
counsel
Yep.
with Secretary David Bernhardt, and they're working strongly on that men's and boys sport, boys and women's sports.
Yeah.
Cut, edit, and we're working strongly here with Jessica Parker. Sorry, cut, edit. We're working really strongly with Jessica Hart-Steinman here, who's legal counsel with David, Secretary Bernhardt here, David Bernhardt, that 62% of people don't believe that biological males should be in female sports. Now, across America,
Right.
they believe that. Are they voicing it? Maybe not. But women...
Inner circle, maybe.
Inner circle, maybe. But we have so many lawsuits now
Yeah.
that we're working on. The Oregon, I
Yep.
could just name all the universities that we're working, that the girls have stepped up
Good.
because they were asked to step off the
Thank
podium.
you. Riley Gaines really.
Riley Gaines has spearheaded that. But in Oregon, we had 2 females in track and field that came to us and said, can you help support us? We lost our ranking, we lost our scholarships, we lost everything. And then when we weren't allowed to be on the podium to accept, because we stepped off the podium because we didn't want to stand with the males that had beat us in female track and field, they asked us to step off the field completely and took our voice away from us.
Wow.
Just because we did, like, millions of people took a knee when they didn't want the national anthem at the NFL play, right?
Yeah.
But 2 young girls at a college, sports event
no voice.
can't have no voice. So that's a freedom of speech.
Yeah.
So we're
and
going
it's happening
after.
so much more than people realize.
People don't even realize that it's happening.
Unless you're in it. And come on.
We remember Title IX.
Yeah.
So we're just going backwards when we let males into female sports. They should have their own sports. If they want to have a transgender event, let them have that.
Yeah.
I've said that forever. But people don't realize female college athletes receive $252 million less in athletic scholarships than men, their counterparts.
Yeah. And now we've got men trying to take
their
away.
scholarships away from them. So
and they worked hard their whole life for that.
I know.
It's kind of a no-brainer. The fact that we're even having to have this conversation
that we're having is crazy. It's crazy. It's like when people say, Stacy, 66% of Americans agree that we should be against the law to perform sex change surgery on minors.
Yeah.
Like, why are we even having a discussion about that? That's child abuse. Yeah. If you're under the age of 18, no adult should be able to help you decide. Yeah. I mean, I lived in New York City 25 years in the fashion industry as a model. All my friends that are gay and lesbian, they hate this happening.
Yeah, I know.
They're not for it.
Yep. No,
they're like, Stacy, we fought so hard.
There's a whole group.
Yes.
There's a whole groups of gay and lesbian community that are against
They're
it.
not. They fought so
Gender
hard to
get
all
of that.
Yeah, to
they
get
don't want to be lumped
recognized.
into the same. Yes,
and
categories.
they shouldn't be. So that's kind of revitalization, reaffirmation of women and how we see their roles in America. And then we have the unity across political and cultural divides. According to the 2018 study, 1 in 3 adults could answer at least 4 or 5 financial literacy questions.
Wow.
So if we don't have unity across our nation where kids get a real education, how are they ever going to be able to go out and get a job, afford a mortgage, like all this stuff?
Be a productive member of society, right?
So we want people to come together and start talking, not talking.
Yeah.
It's all about inclusiveness.
Again,
You've always talked about that.
All of these are bipartisan
all
issues.
All of them.
These are human issues.
Yes,
human
absolutely.
Issues.
Absolutely. And President Trump has worked so hard with that, we call it OB3 now, but the one beautiful, big beautiful bill. But OB3, just about tax relief.
Yeah.
For Americans. No tax on tips. I did an op-ed on that and it got picked up and the White House retweeted it. I was so proud because I said, people that work the hardest, that can afford to come in a physician's office. Let's just think about how it transpires.
Yeah.
The everyday hostess and waiter or waitress they're just living on tips, but we're going to tax that, right? They make such minimal.
Well, that's the whole reason
money.
they make their $2 an hour is for taxes.
Exactly. To then they get taxed on tips. I think that was one of the biggest things. This, on especially overtime. They make their money on overtime. So being able to change that. Also, no tax on car loans.
Yeah.
How are the automobiles getting to the jobs, and we're going to tax that?
Yeah, exactly.
To get to their doctor, to their physician, to get healthy. I mean, all these things make sense. They don't make sense when you think about, well, I'm not, one of my kids is not, I was a waitress when I was a young girl.
I was too.
If you're like a hard worker, you couldn't work enough jobs. Babysit, mow yards, work on my parents' ranch.
Yep.
And on the weekends I'd be a hostess and split the tips with the waiters.
Yep.
But then we were all being taxed on that. It makes so much, it's common sense
stuff.
So common sense. So that's really, that's what we're supporting is common sense laws, litigation, and just trust in America's goodness.
Yeah.
So many people don't know that kids don't know civics anymore.
Yeah.
They don't know the real history of America and what was given up for them to have their freedom. There's so much we're going to do a civics across this nation tour. Awareness.
Yeah.
And it's just to bring awareness to people so that they can be on the stronger side of what's right.
100%. Okay, the U.
Oh my gosh. The U, that was for unity across our political and cultural divides.
Anything else
and
about
then
you, yeah.
I think that's it. I think that's
the main thing.
The main thing. And
Yeah.
then trust in our goodness in government and our nation. That's pretty much teach kids. Again, the American people are overwhelmingly agree that promises kept are promises made. We need to make sure this country, when a politician says something, that they stand by it for their constituents and their states.
100%.
Far too long we've let people get away with saying one thing and not walking their talk once they got in office.
Well, that's why people don't trust it. That's why so many people say, forget it, I don't want to vote.
No,
it doesn't matter. They're not going to do what they say anyway.
That's right. Doesn't matter. I don't need to be involved.
Yep.
You need to be involved. 2026 will set the precedence. People think
100%.
we've gotten freedom now. We could lose it all.
Yep.
So 2026 will be the year that people really step up, step out, speak out.
Yep.
Like if you're not door walking in your neighborhood, those people know, love, and trust you. They're going to open their door to you. They're going to listen. We don't always have to agree.
Yep.
And that's a beautiful thing.
But
that's when you create
exercise your
dialogue.
right
Absolutely.
to vote.
Exercise your right to vote. Give somebody a ride to the polls.
Right.
I mean, I think one of the greatest things here at America First Works at our C4 was that we were finding people said, I'd love to go vote, but I don't have transportation.
Yeah.
I can't get there.
Let's fix that.
Let's fix that. So what did we do?
Yep.
We got together with transportation companies all across the nation. If you were a veteran, handicapped, and you could prove, I just have no way, no loved one, I can't take public transportation to get, we provided it.
Yeah.
We
That's awesome.
had an account. We sent them there. They got to go to the voting
we were
polls.
like Ubering people.
Yes,
Yep.
at Lyft and Uber. And then they'd wait, the driver would wait for them to come out, get back and take them back to their homes. And why was that important? Because some people say, I have a voice, but I just can't, I can't get it out there. I just can't use it. So I think that made a huge difference, especially for our veterans.
Yeah, absolutely.
That are handicapped and they just couldn't get. And I think also, I mean, maybe it's just me, but I'm all about paper ballots. I don't want it that digital anymore. I want a transparency in that. And I'm speaking personally for myself. I would love if we got off a day for voting.
Yeah. Yep.
It's
like
our
a national
right.
holiday.
A national holiday. We give so many months to this all these different events across the nation, but we don't give the one day that we need to vote. And this whole like 4 months or 4 weeks of voting, no, it's a one day thing.
It's a one day thing, and even businesses, you know, we letting their employees come in late so they can go late. Yeah,
we used to.
Yep.
We used to say, hey, come to the office. We'll have donuts and coffee. We'll all go together.
Yep.
And then if you know what, if a family member needs a ride, we'll stop by and pick them up too.
Yeah, it's so
we
important.
just always did that kind of stuff because we thought it was important.
Yep, good. So the H.
Health, that's you.
My
Health of mind, body, spirit, and we talked about land earlier.
Yes.
It's just so important. I mean, it all starts with that.
Yep.
As you know, I lost my husband this year.
Yes.
Heartbreaking. So healthy. That's what I could never understand about David. He was so healthy, no medications, no vaccines. We tried to do everything right, but sometimes God has a different plan.
100%.
And I really look at health differently now. Like I told you, I need to get in shape. I want to get in shape for the first time. I haven't, it's been 100 years since I was a model. Did it for 25 years, never had to worry about weight. But then life gets in the way.
Yeah, life gets in the way.
We don't work out. I overeat. I'm a nervous eater. I get in a meeting. I'm eating. I'm like, all that stuff, it's really a lifestyle change.
It is, and you said something really important with mind, body, spirit, and I think a lot of it, that's where it starts. Is what are we doing to teach people other practices also for stress management?
Right.
And what are we doing, what self-responsibility, what are we doing to disconnect ourselves and, especially with our kids? This is where I see it the most. I mean, we're grown adults, we can make choices.
Sure. Not always the best ones.
Yeah, maybe, but you know what? We're adults, we can do that.
That's right.
The kids are where my passion is. Obesity is rampant in this country. We're getting kids addicted to foods from babies with baby formula.
That's right.
The main ingredient is high fructose corn syrup. It's highly addictive. It's causing a lot of problems. I witnessed this even recently. I shared my story. My new baby, grandbaby, Rigby. He's so sweet, such a beautiful baby, but he's a product of a diabetic mom, you know, and this is all preventable.
Yes.
You know, and so there's and it's not only a burden to the families, it's a burden to taxpayers. And we've talked about this, and I love the fact that is a key part, because women, America First Women's Initiative, women are the primary medical decision makers in the home. We're the primary food decision makers
80%
in
of
the
decisions.
home. Yes. And so the fact of just bringing awareness of these really important issues is just so vitally important. What do you want to say about the H in healthcare? What's just other than what we've already talked about?
Well, I'd really love for us to see transparency in insurance.
Yeah.
I've thought for years, and we've got a whole team here now talking about it, how healthcare and insurance should be able to cross over state lines, and this and that, and how conglomerate, you know, like a large group of people should be able to. We used to provide health insurance for our company and our employees, but if you don't have a large enough group, thank God we did, 200 employees, to put on a great healthcare plan, it's crippling sometimes for business owners. Say you have 5 or 10 people working in an office. It's just not enough to get the rates where they need to be. I would love us to look at really the healthcare and how people can buy in volume and collectives. I mean, I've seen that.
Incentives, more incentives for preventative, doing actions for preventative wellness and things like that.
We have none of that.
So much
Nutrition and health.
Yeah,
What did RFK Secretary Kennedy just passed that you were talking about with me earlier in the month? You were talking about how he said. I just went completely blank.
It's all right. We'll edit it out.
Healthcare, and he was talking about. Oh gosh, I can't remember. It was. I've slept since then, or maybe not. I cannot remember what it was that he talked about. I'll remember when we walk off the set, of course. Right. But it was so healthcare. Oh, I can't remember, but it was so good about how he was going to actually change something.
I'll figure it out, and when you do, I'll make a thing about it. All right, so I'm going to pick it up from here.
Okay.
So America First Women's, the Truth Initiative, lots of things going on there. I'm very excited about the event coming up in 2 weeks. Let's talk a little bit about that.
Sure.
This show is going to drop next week, so everyone listening to it can know what's going on with this, but talk about the event that's going to be in Dallas.
Absolutely. We're going to have an event, August, Women's Initiative. America First Women's Initiative is having an event August 18th in Richardson, Texas, which is a suburb of Dallas. You're all welcome from across the nation to come and be a part of it. There's 417 seats. We've already filled 300. They're only $40. That's not a fundraiser. It's just to pay for the beautiful, we're at the Eisman Center in Richardson, Texas, just for the facility and the hors d'oeuvres and all the food. But the most incredible thing is the dynamic women that are going to be you're going to be able to hear from up close and personal. So it's Secretary Linda McMahon and I are going to do a fireside chat in the beginning. Then you're going to get to hear from Dr. Terri Show, and then 6 other dynamic women from across the nation, all the way to Marcy McCarthy. She is CISA. She is now in charge of cybersecurity for this administration.
Amazing.
So you have so many people,
powerful females.
Business females, authors. You have media. Jen Pellegrino from America First Policy Institute is going to be there. She's been on television for years as a correspondent, and she's now our official spokesperson here. There's so many different women from NFRW, National Republican Federation of Women, 136,000 women. Julie Harris is over top of in this nation, just to make sure that we do the right thing. It doesn't matter what side of the aisle. Just use common sense. That's all what she's about. But there's so many dynamic women that are going to speak there. We also have Debbie Georgiados from Texas. She'll be there. There's so many exciting women, but we'll put up the link.
Yeah,
you
we'll
guys
put the
can
link
come.
in the show description.
We'd love to have you guys in the description of the show about what it's all about. But it's just a time for women to come come together for a time such as this to say we need to collaborate, be inclusive, not exclude anyone.
Right, that's right.
Due to any ethnicity, party, or anything. This is a time where we all come together and we talk about the problems of our country and how can we fix them, and also learn a thing or two about business. We have business entrepreneurs there that have got 4 and 5 companies they're running.
Yep.
So you'll learn a lot from
That's
these
awesome.
innovative women that don't stand on the sidelines. They get inside it.
And then for anybody that wants to learn more about America First Women's Initiative, they can go to America First Policy Institute,
right,
and find a link from there.
That's
and
right.
America First Works and all the amazing things that you're doing here at AFPI that I'm just really blessed to know about and be a part of, and so grateful. And thanks for taking time out of your busy day. It's a busy week here with the Farmers First and the Farmers Market. So I appreciate you taking time to pop
And thank
over.
you so much for being on the Women's Initiative Advisory Team.
Yeah, I'm
16
excited about that.
amazing women from across the country.
We're going to get some work done.
We're going to get work done, and we're looking for ambassadors, 3 to represent
Yes.
each state across the nation.
Yes.
150 women that will fall under the advisory team, and they will take it into their states and just grow sectors as ambassadors for women just wanting to be in the know and enlighten men. We always invite our men.
Of course.
Always have. It's not a woman or man thing.
Yeah.
We always say, come along. Yeah. We have to do this together. We cannot do it alone, and we need both genders.
But clearly across the board, whether it's health or education,
Yes.
in all of these areas, when women have been a underserved voice
Yes.
in all of these issues. So I'm so grateful to you, and thank you for being here today.
Thank you so much, and thanks for having me.
All right.